For my SOPs, today I'm going to be sharing questions you should ask during your CF interview. These are questions or DMs that I get all the time, and I am answering all of your questions. Guys, welcome back to my channel. I'm Denise, also known as Diamond. If you are new to my channel, thank you so much for stopping by and welcome. Hopefully you subscribe and stay tuned. If you are not new, as always, you already know I appreciate you for being so loyal. Let's go ahead and get to this video, guys. This is for my SOPs. Today I'm going to be sharing questions you should ask during your CF interview. These are questions or DMs that I get all the time, and I am answering all of your questions. I get a lot of DMs and I'm happy to respond. Feel free to always DM me. I will always respond. Always. If I do not respond the initial time, just send me another message and be like, girl, my message, and I will get to it. I know I get a lot of DMs sometimes and it gets lost, but I got you. I want to help you. If you are DMing me, most likely I probably will refer you to some videos first, because I answer a lot of your questions. If they're just general questions, I usually go ahead and respond. But when y'all ask like a lot of questions about videos that I've already made, I'm like, go check out the YouTube channel and then come back and ask me questions, because it's like kind of redundant just for me to like answer all those questions again when you can get all of them in a thorough video. I made the video just for you, and I want you to see the video and then ask me questions if I didn't cover anything, just so we're like on the same page. At least we have a foundation set, okay? And that's why I do that. But if not, feel free, slide in the DMs. I got you, girl. I got you, guy. I got you, whoever you are. Get in my DMs and I got you for sure. So let's go ahead and get into this video because I'm rambling. I want to go ahead and share you guys some questions you should ask during your CF interview. I know it's almost time for people to start interviewing, coming up in May, April, March. So it's going to be time for some CF interviews, and I want to make sure you guys are prepared and ready to secure that job. Okay, so these are questions. First, I'm going to share with you guys questions that you can ask the company so that you can kind of see if you're a great fit for them, and then questions you can ask them to see if they're a great fit for you, because the interview works both ways. Okay, don't think just because they're interviewing you, no, you're interviewing them as well. So I'm going to give you guys questions to ask on both ends. So let's start with questions that you can ask them to see if they're a great fit for you. The first question I would ask, or one of the first questions, and feel free to tailor these questions how you want to, but what is a typical day in the life like in the position I'm going to be in? I'm not sure if you're going to be applying for a medical, hospital, SNF, home care, home health, teletherapy, private practice, skilled nursing facility. There's so many places you can work. So you want to know, what is the day like in the life? What is a typical day like for this position? Will I have to travel? Will I be stationary? Will I be doing therapy in-house? Will I be also doing teletherapy? Will I be splitting my days? Will I be going from one facility to the next? Will I be seeing pediatrics and adults? What is a day like? You want to know exactly what to expect when you get there. Another question you can ask is, what is the documentation process? Are we documenting online? Are we using paper? Most facilities are probably going to be doing a lot of things online, but you really want to know. One thing and a reason why you want to ask about documentation is because you also want to ask what are maybe some of the process that you will have to be responsible for. When I took my CF position, I was in outpatient seeing pediatric and adults, and I was responsible for writing plan of care, faxing those to the doctors, getting those signatures back, then forwarding it to the our person that does all the billing and insurance for these patients, then trying to get that back and making sure I contact the patient and say, hey, we got your insurance authorization back, now we can start scheduling your visits. And then I had to go make sure the visits were being scheduled, and it was a lot. Okay, so if you like outpatient and you're fine with that, that's cool. However, number one, that is not every outpatient setting. I know people that work in outpatient that do not have to do all that. So you want to ask those questions because you want to know what's going to be your role. Ask about relocation assistance. Sometimes I know it's expensive. Sometimes if you're moving from far away, depending on what type of job you're taking, I don't know what's important to you. Maybe you really want to go to this setting and just get your CF done, so you're willing to travel far, or maybe you want to stay close to home. Regardless, ask about relocation assistance. Some jobs will offer that. Now, I'm a little split when it comes to that, because I shared this before, I took the relocation assistance and I kind of regret it. Because I took the assistance, I had to commit 2 years to the facility. I did not stay 2 years at that facility and had to pay all that back without them giving me any kind of, I literally was almost there for 2 years. long story short, I had to pay all the money back, okay? So really ask those questions. I think 2 years is a big commitment being a CF, because you don't really know if that's where you want to be. But if you're confident and you know it's where you want to be, and you feel like you will stay in that position, then go ahead and take the bonus, because it definitely will save you some money. It'll help you with your move. Another question you can ask is about your C's. Like, after I get my C's, will there be any type of increase in maybe my salary? Am I able to get any kind of type of advancements within the facility or the job or the structure? Ask about those things, because you want to know, if I choose to stay here, I'm investing my time here. Will there be opportunities for me to grow personally, financially, within the system, and things of that nature, and really get the experience that you really want? Another question you can ask is about continuing education. CEUs, you're gonna have to, have your license paid for. You're gonna have to also do CEUs. Well, as a CF, you really don't have to, but maybe there's some opportunities or things that you want to do or learn more about. I know during my CF, there was a pediatric feeding course. My facility paid for that. I've also taken a trach and vent course, suctioning. My company paid for that. So those are things you want to ask about. Like, does the company offer those type of assistance, if that's something that you're willing to do, because you're gonna have to do it. So if you want the company to pay for it, it'll be great, because you're gonna be investing those skills that you learn right back into the facility. Ask about your supervisor. This is like the big one, okay? You want to know, is my supervisor going to be on site or off site? How will me and my supervisor be communicating? Are we going to have to communicate via text, via email? Will there be allowed a time for us to be able to meet in person? Whatever kind of person you are, I'm an in kind of person type of person. I like to sit, look at you, talk to your face. I want to hear exactly how you feel, what you're saying. Like, I need to get it like that. So ask about, the type of supervision that you want, and if that'll be available for you, because sometimes during your CF, you may have a supervisor that is off-site on another campus. 9 times out of 10, they're still working in the facility and the company. They're gonna be giving them a full caseload, unless they really are being considerate that you are a new clinician coming in. That person's gonna have a full caseload, and if they don't have time to help you, it's gonna be really hard. And you guys know I struggle with that a little bit, because my supervisor, she did great. Like, we did great managing the time, but it was hard. Like, we didn't get the time we really wanted to be able to communicate. So that's something that I always try to push out for you guys to ask, to get help with, because it is super important. You want to know if your supervisor has mentored other students before. This is just a good question to ask, because it helps you understand where they are with mentoring. And then you can ask them, how do they mentor? What is the type of, how do you communicate? What type of skills do you look for in someone that you're training? How do you train? You really want to know the person that you're going to be working with for the next 9 months, and if you guys will be compatible and be a good fit. If they have experience working with students, if they worked with a lot of other students before, they might really like training. It doesn't mean that they are the best trainer, but they probably really like it and enjoy teaching, and are going to be more patient with you, versus someone who, maybe it's their first student. I'm not saying stay away from people that it's their first time mentoring, but they're still learning how to mentor while you're learning. And it's not that they're practicing on you, because they obviously have the skill set to do so, but it could just be a learning curve for the both of you guys. So you really want to know, what is their experience, and also what is their experience in the field? What are they doing? How long have they been practicing? Look them up on ASHA and make sure that they are active, okay? Because there was some rumors back when I was in grad school that people take students and they do not have their license. So make sure that the person is licensed. You can look that up on ASHA by their name, where they are. I think if you have the ASHA number, something like that. So just go on ASHA.com and look that up. And see what their experiences are. Ask them, like, what do you do? How long have you been practicing? What is your area of expertise? What do you like? So you just know who you're working with. Another question you can ask is about the expected caseload. I think I kind of touched on this earlier, but you want to know, how many students should I be seeing? Not students. How many patients will I be seeing? What are their productivity requirements for me? I know in maybe medical settings, it's probably like 24 for an 8-hour day. Outpatient, they kind of give you patients every day, all day, like on the minute. So just ask, like, what are the requirements? Initially when I started, they allowed time for me to like have time to document, so they put blocks in my schedule. But then once I got in there, they was filling me up. So just ask those questions so you know what to expect if you're doing private practice, or if you're doing, maybe, I'm not familiar with home health, but I know some people in private practice, they are seeing clients in the clinic and then they have to go to the school and see clients. I think they have a certain amount that they have to see every day, but those are questions that you really want to ask and you want to know about, because you're going to be the person in the shoes. They're going to be looking to you for all the answers. They're going to expect you to know every single thing, and even though you don't, do not fake the funk. Do not fake the funk in any setting you are in. Always ask for help. Always be teachable. Those are like the top things that I always stress. Like, y'all, we do not know everything coming out of grad school. Matter of fact, we don't know a lot coming out of grad school. There's a lot I still do not know. And if I'm, even now where I'm at now, I'm in a setting that I love, but if I don't know something, or I'm not comfortable with the patient, or I don't go in there acting like I know it, help me, okay? Because I need to learn, or I'm gonna be looking online. MedBridge, by the way, you can get a code if you want in my description box, but MedBridge or somewhere online, the STEP program, somebody has some type of information where I can learn this skill, because there's a lot of skills that we do need to learn. And going into your CF, there's gonna be a lot of skills you do not have. So always be teachable, guys. Always be willing to learn. And that is one thing I really want y'all to take from this video more than anything, because in the setting you go in when you're interviewing, they're gonna maybe ask you questions about what is your experience like with this, or what is your experience like with that. I always like to phrase, hey, I do not have much experience in this area. However, this is what I do know about the area and I'm willing to learn. So now they see, hey, you know what? She doesn't really know, but she has a little foundation, and this is the area we can teach her and help her grow and meet her halfway. Key, golden. Okay, that's like the golden rule. All right. Another question you can ask here: what are some of the challenges that the person in this position, or the person that was in this position has faced? This helps you just kind of understand, like, maybe what to expect going in, what may be some areas that may be difficult, and you can kind of gauge whether or not you feel like you'll be able to handle that. And the last question is, how will I be trained? Going into your CF, we already know we're being trained. How will I be trained? Will I have, you know, a month? Will I have a week? Will I have someone to kind of help me, walk me through, guide me? Or am I going to be kind of learning from everybody? Me personally, when I came in, I was learning from a lot of different people, and it was kind of challenging because I had maybe six people that had different ways of doing things, and I'm just trying to learn one way so I can get started. So I'm great at multitasking. I learn pretty quick, so I was able to really adapt, but that may not be everybody. So just know your style going in so that you can communicate what you need, because during the CF, it's not your last opportunity to get help, but it's kind of a position or a time in your career where you will have a lot of opportunities to get supervision as a CF, because they know that you are still learning. And the expectation may not be as high, but still be teachable, still be willing to learn, always educate yourself. But just kind of really take advantage of the time, because whatever you need, you really want to make sure you get out of it. Not saying you can't ever get it again, because I'm getting it and I'm done, but just really take advantage of the opportunity and let the facility know what you need. Be very vocal about that. All right, here's some questions that you can ask to see if the facility is kind of a great fit, if you feel like you'll be a great fit for the facility. I'm gonna try to go through these pretty quickly because I don't want to hold you guys, but I know the video's getting kind of long. Me and my stories. All right, so what is an ideal candidate? What are y'all looking for? What do you expect? You know, that one's kind of straightforward, and they'll kind of let you know the skill sets they're looking for, and you can kind of see, do I have some of these skills? Another question you can ask is maybe what skills or what attributes would be helpful to help me succeed in this position. That'll also kind of give you information about maybe skills that you may have or may not have, but things they are looking for you to be in that position, whether it's flexibility, whether it's time management, whether it's being very organized. All those are great things that a job may be looking for and could probably help you in whatever position you're in. the final question you could ask, which I think I already touched on this in the other one, was just basically what was my performance expectation. So what are the expectations of someone that is coming in to fill this position? What are you expecting from me as a new, you know, employee coming in for this job? So that's all I have right now. I am making a blog post, so if you click the link in my Instagram bio or go to thediamonddenise.com, sign up to join the family, because I am going to create a whole blog post about this. I have some other SLP blogs out there already, some very helpful, insightful things for you guys. So thediamonddenise.com, join the family so you'll get notified when I make new things and new posts. But you can go definitely check out my SLP section, and you'll see some blogs that I've made before, and you'll see this one coming up really soon that'll go into more detail, that I have some more questions and all that good stuff that will be helpful for you on your journey, because that's what I'm here to do, okay? Hopefully this video is very helpful. Hopefully you enjoyed it, and do not forget to like, comment, and subscribe, guys, so you can see more videos. I will see you in the next video. Bye. I was gonna